Senate Ed, January 12th. More important, great to see you.
Great to see you,
Feels
Senator.
like in some ways it was yesterday, but it's been a long time. You worked really hard on universal meals, as the Senator Sheen in particular. Bill was passed, Governor signed it. Give us a little update on where things are. And then we also have Rosie Kruger, I think, zooming in.
Yes. So I'm Honora Horton. I'm the Executive Director of Hunger in Vermont. It's great to be back with you all in Senate Education. And I'm really happy to have been invited here today to share with you all some of the tremendous success of what is now Act 64, Vermont's Permanent Universal School Meals Law. And this committee also did a tremendous amount of work over 3 years to make the Universal School Meals Law happen. So I'd like to to begin, I'm going to leave it to the Agency of Education to provide the most current data on what is happening right now this school year. They are the ones who collect that data, and happily they're here with us today. But I would just like to begin by sharing some statements about how Act 64 is working from the people who are implementing it in schools. And I really hope that each one of you on this committee, we spent quite a bit of time together last year and the last session, and I hope that each one of you hears in their words a loud and profound expression of gratitude to this committee for all of your hard work over 3 sessions to pass this life-changing law for students, families, and schools. So Kelly White is a site coordinator for the Essex Westford School District, and she sent me this quote. Universal Meals in Vermont has helped so many families. This program has not only improved access to nutrition for children, but also helped to ensure that families can allocate funds to other important expenses such as housing and healthcare. Universal School Meals has created a more inclusive and supportive environment where children feel accepted and can focus on their education without worrying about where their next meal will come from. By giving our students access to healthy and satisfying breakfast and lunch options, we can set them up for success in the classroom. My own family has certainly benefited from the program, and I know many folks in our community feel the same way. Stephanie Gates is the food service director for the Bennington-Rutland Supervisory Union. She writes, the students' expressions of gratitude serve as validation for the effort invested in enacting universal school meals into legislation. Universal School Meals has promoted inclusivity among students, alleviated financial worries about school meals for families, and delivered substantial advantages to our community. Carol Kent, the food service director from Lamoille North Supervisory Union, writes, Universal School Meals has changed the culture of school meals at Lamoille North Supervisory Union. And our middle and high school meal times are far less stressful for students. They come to our lines with healthy, delicious food choices. They interact with our cashiers with friendliness, lively banter, and gratitude, where in the past there had been some trepidation, fear, and shame. My 40-year-old daughter was at a gathering with other moms, and the talk was all about how great it was that they do not have to rush their kids in the morning to get breakfast into them, knowing that they can have breakfast with their friends at school. For families, it has relieved some stress from the morning rush. It is a joy every day to see children just enjoying meal times together, regardless of income levels. They all have the same choices. And finally, Scott Fay, the food services director from Essex Westford School District, says, with Vermont's Universal School Meals program, schools are able to focus on producing quality meals and providing excellent service to students. Cash collection and the process of collecting on bad debt associated with paid meal programs has historically put wedges between schools and families in need of support. With Universal School Meals, we don't create barriers between families in need and schools. We build bridges. So I just felt that I could come in here and say, as an advocate, Universal School Meals is making a huge difference out there in schools. But I think that you heard it better from the people who are actually on the front lines of delivering on the promise of Universal School Meals.
Do you have a sense of how things are working with agriculture and the farms? And one of the big pieces of this was trying to keep dollars local.
Yes. Well, I think that the local food purchasing incentive program, which was kind of meant to be paired with universal school meals, is up and running, and schools are really working to rise to the challenge that purchasing incentive program extends to them, which is to use more and more local food and send more and more purchasing dollars to Vermont farms. And I also think that there's been some real challenges because of the incredible inflation in food costs and labor challenges that school meal programs have experienced, and the agency may be able to speak to that more definitively. But the Vermont's Farm to School program is still going strong, and Universal School Meals absolutely contributes to the success of that by having kind of a larger group of students who are partaking of those meals and bringing millions and millions more in federal funding into Vermont's school meal programs to be used to be able to buy Vermont food from Vermont farmers.
Thank you. It's good to see you again. Thank you for being here, and thank you for all the work you do on this. I wanted to ask about mental health. I know one of the things that we've heard a lot about over the last year is the growing challenges of mental health in schools amongst both students and teachers, really. But I think there's a lot of external factors, both locally on the state level, but also nationally and internationally, that affects people's mental health. And when it comes to a basic need like this, have you seen that this has had a positive impact on kids' mental health? Is it one of the factors?
Yes, and I appreciate the question. I think you're right that there are a lot of different pressures on young people's mental health right now, from the global to the inside of their own family situations. And I think we heard in some of the statements here, there hasn't been a study that directly correlates providing universal meals with easing of student mental health, but there is a lot of this anecdotal evidence that families and students are expressing an alleviation of a feeling of stress and shame and disconnection, that having that dividing line of, are you free eligible, or do you have to pay, and is there money in your account, and there's no money and we're behind on our account, so my parents are not going to come to school because they're embarrassed that they owe money, and there's a lot of those kinds of stresses underlie students in the past in Vermont have underlain students' educational experience on a daily basis, and just removing those stresses as we have done, and for many families also removing the need to complete those very burdensome and intrusive school meal applications and disclose all that financial data in that way. All of that, I think, is contributing in very important ways to allowing schools a little bit more opportunity to focus on educating students. And I know there's so many other stresses that are still there for students and teachers, but I think this makes a huge difference, without question.
Thank you.
Any other questions from the scoring before we shift to this group of agency? Do you mind staying, Lenore?
Oh, no.
Well,
I'm
right
happy
there,
to.
great.
Sure.
Ms. Kruger, another one of our incredible Agency of Education public servants. We just heard from Jessica Carolus, and So glad you're with us, and so glad you're going to give us a report on school meals, what you're seeing on the ground.
Hi there. For the record, Rosie Kruger, I'm the State Director of Child Nutrition Programs at the Agency of Education. I don't have any written materials for you today. I apologize. It's kind of late notice getting this together. I am happy to provide some written materials afterwards if there's any particular area that you're interested in. So I'll start by saying that overall, universal meals implementation this year is going very smoothly. This was, of course, as you remember, last school year was a pilot year. And so we came back to you last year and said, okay, if you want to make this permanent, here are some areas where we need some clarifications and some areas where we think needs, further discussion from you about what your intention is. And you took all of those suggestions. And so the final law that was passed was very implementable for the agency. And so the implementation this year has gone kind of as expected. Participation is up slightly this year from last year so far, like 2 to 3% when we look at July through October, which is the latest numbers we have. We're always a little bit behind because schools have 2 months to report their participation numbers to us. So October is the last full month that we have available. Participation last year was up significantly from pre-universal meals, and we gave you those numbers last year. And overall, participation last year ended up being in alignment with what we were sort of projecting in January of last year. Our costs, though, were lower. So you had initially appropriated $29 million for last year. In January, we came to you and said we thought that it would be about $27 million. And ultimately, it ended up costing about $24.5 million last year in state funds. And the reason for that was not because participation was lower. Again, our participation numbers were as we had projected in total, but participation was higher among free and reduced eligible students than we had projected. So when we did our projections in January of last year, we assumed that all students would eat at the same rate. That was a very conservative assumption to make because you might think that low-income students would be more likely to take advantage of the meals at school. And in fact, that is what we saw. And so that is why the ultimate cost came in lower than we were predicting in January. Because of the way that the schools have 2 months to report back to us and for us to make the payments out, we incurred $24.5 million in costs in the policy last year, but we actually made $22.2 million in payments by June 30th. So I'm not quite sure how that ends up hitting the education fund, but just wanted you to have that difference as you look at the impacts. Our estimates from this year are a little bit higher. That's a very, very conservative estimate for this year. So this school year, the per meal rate for the universal meal supplement is higher than last year, and it increased more than we expected. And that is because the universal meal supplement is set to be the difference between the free and the federal the federal free and the federal paid reimbursement rates. And USDA sets those rates every year based on inflation, and those adjust slightly. Last school year, Congress had put more money into the school meals program, and so the rates had increased a little bit. And then this year, that funding expired, and so the rates decreased. And for some reason that I can't quite follow, they decreased more for paid meals than for free meals. And so the per meal reimbursement rate this year is higher than we were anticipating. But counterbalancing that, there's a lot of good news when it comes to 2 federal changes that we were thinking might take place this year. And so those 2 impacts, which I'm going to talk about in a minute, have counterbalanced that increased meal reimbursement rate. So our very, very, very conservative estimate of how much the program may cost this year is currently $26.5 million. I fully expect that to come in a lot lower, but that is kind of if participation stayed exactly the same as last year in terms of the different categories, and we took into account the increased per meal reimbursement rate this year, that's where we'd end up. However, you may remember that last year we had some difficulty with families not returning their meal applications. So that was a concern in our implementation. We were worried that there wouldn't be incentive for households to return the applications if meals were free. Those children's status as low income wouldn't change in practicality, but we wouldn't be able to draw down the federal funds for those meals, and instead the state would be paying for those meals. We saw in practice that happened a little bit, and it was very variable across the state. So some schools had a lot of difficulty getting households to return applications last year, and some schools didn't. And so we overall did see a drop in our free and reduced percentages statewide last year, not necessarily reflective of anything that was happening with regard to the child's actual economic status, but just folks not returning those applications. It was not as low a drop as we had feared. So our initial estimates and working with JFO made some conservative assumptions that maybe nobody would return applications. And so we knew that probably some people would, and we weren't really sure exactly how many people would. So last year we did see a drop in folks returning applications, but some folks still did. This year we
Senator,
have.
Rosie, if I
Yeah.
could, so I believe I'm maybe not understanding a certain aspect of this.
Sure.
So there's a federal component, there's a state component, two sets of subsidies come together to fund school meals. What you're talking about is parents who are not providing the paperwork necessary to recognize some portion of the expected federal subsidies. Is that what you're alluding to?
That's exactly right. So there is some amount of federal subsidy for each type of meal, free, paid, or reduced price. But the free meals that qualify at the free rate are paid for entirely by the federal government. The reduced price and paid meals are, there's some federal subsidy, but then the state picks up the rest of it under this law.
Does the current funding recognize the fact that parents no longer have a incentive to provide any paperwork to recognize federal subsidies?
That was one of our real concerns with going into this. And we found last year that some families still did, not every family, but some families still did. So it's sort of in the middle there. The really exciting change that has happened this year is that Vermont applied for and was approved and is now participating in USDA's direct certification through Medicaid pilot. So this allows us to use information on low-income students participating in Medicaid to directly certify those students for free and reduced price meals without their households having to return an application. So that means that even though there's no incentive, we're still getting the information from the Department of Vermont Health Access instead of the families, and we're still able to draw down those federal funds. We were really hopeful about this when we talked to you last year, and we don't have full data yet on it. We're still collecting information back from the schools on how successful it's been, but about half of the schools have reported back to us, and as of October, we were identifying about more than 7,000 new students for free meals and more than 2,000 new students for reduced price meals. And so our projections last year were that the Medicaid pilot was basically going to make up the difference. So because we have really high uptake of Medicaid in Vermont, that almost all the students, if not all of the students who had previously been identified via applications, would now be identified via direct certification. And that's really what we're starting to see. And again, I don't have perfect data for you yet, but all indications are that it's working very well. So that's really exciting. And that's a reflection on a lot of hard work at the Agency of Education, the Department of Vermont Health Access, getting our technology systems all ready to go to be able to use this pilot from USDA. So that's exciting, one, because it's helping us draw down more federal funding, even though those families are no longer returning applications. It's also exciting because direct certification allows us to participate in the community eligibility provision. And you may remember from last year that there's those two federal options for offering universal meals. One option is the community eligibility provision, and one option is provision 2, and that the community eligibility provision is the more advantageous option. But it's only available to schools who have a certain percentage of their students who are directly certified. So this Medicaid data that we're getting means that more schools have more children who are directly certified, and more schools are hitting that threshold to participate. The second change that happened this year that we were hoping would happen is that USDA published and finalized their rule changing that threshold for schools to participate in the community eligibility provision. They published this rule in late September, and it changes the threshold from 40% of the students in the school or a group of schools needing to be directly certified in order to make them eligible, changes that to 25% of students needing to be directly certified in that school or group of school. With that in combination with the Medicaid Direct Cert pilot means that many, many, many more of our schools are eligible for CEP. We went ahead and applied for a waiver that USDA was granting, and we received it to allow our schools to take advantage of that rule change right away. And so starting in October, we were able to allow schools to switch over to CEP using that new threshold. So ordinarily, we would have had to wait an entire year to be able to implement that. And then more recently, in December, USDA clarified for us that we actually could use information from this school year, including the Medicaid direct certification information, when switching over folks mid-year. So previously, they were telling us we needed to look back at the April data, which did not include all the newly directly certified Medicaid students. So this has been a lot of work for my team this fall in, getting all of that information from the schools mid-year, switching them over when we got that new guidance from USDA, taking the new data and looking at that. But the result is that 103 schools are newly eligible for CEP and have switched to CEP this year, bringing our total schools participating in CEP to 223 schools. And that number may actually still increase. We gave schools a deadline of January 15th to tell us that they wanted to switch over mid-year. And I just got another letter from another school asking to switch over. So this is really great news. CEP, like I mentioned, is the more advantageous option. It's a little less paperwork, and it also allows us to draw down more federal funding because of the CEP multiplier. So we take the number of directly certified students, we multiply that number by 1.6, and that is the percentage of meals that we can claim at the free reimbursement rate. So our direct certification rates are now becoming equivalent to what our old free and reduced rates were in combination with direct certification and applications. And then when you take that and multiply that by 1.6, that means that we're able to draw down even more federal funding. So that's all super good news for the ultimate cost of universal meals in Vermont. Because we're still making all those switches and because they were mid-year switches, I can't tell you exactly what that's going to be, but we do think it's going to save the state millions of dollars on this program. So we've put 26.5 million as a very, very high end placeholder in, but that's before making any assumptions about all the schools switching over to CEP. All these schools being newly eligible for CEP is also good news because all of those children at CEP schools, all of those households qualify to participate in the Affordable Connectivity Program, which is a reduced price internet program that the federal government runs as well. And so that program is available to every student attending a CEP school. So that's just a kind of an add-on benefit of maximizing the number of schools that are participating in CEP. if the state wasn't doing universal meals, and, you know, this rule change had happened, those 103 schools who are switching to CEP, they all would have had that option, but they would have had to come up with a lot of local money to do that. And based on what we're seeing in other states, some of them would have decided to do it, but not all of them would have, because it's a significant amount of local money. So we're seeing much higher transitioning here in Vermont to CEP than other states that don't have universal meals are seeing. So we talked about those two rule changes or two federal changes, and just that those are really kind of working together to have a really positive impact for Vermont. The two changes also impact area eligibility in Vermont. So area eligibility is this federal requirement about what sites are able to operate free open meal sites during the summer for all children 0 to 18. So not all of those CEP schools will qualify for area eligibility, but many of them will. And so this rule change